All right, I got a kind of a fun segment coming up, and I know Travis is super excited about this because he knows what's coming up. And I don't want to spoil the surprise.
Let's get all the pictures.
I got I want to do a segment. This is based on articles. So this segment is nipple reduction in men and other weird plastic surgeries. And so I got the idea from, what's Sarah laughing? You know who
I'm
that
just
is,
like,
right?
yeah, I know
Yeah,
who
okay.
that is, but I'm like, he has tiny nipples.
Right. So I got this segment from an article that popped up. I think it was New York Post. Throw it up there, Travis. People want to look at it. Yeah. I think this is New York Post, but you can look it up. New York City men paying plastic surgeons 5 large for almond-shaped nipples like David Beckham's a growing trend. So I want to say that there is a misprint or misrepresentation in that title. It's not the nipples that people are getting done, it's the areolas. And this is a really common confusion. So, you know, on the breast, whether it be a man or woman, there's the nipple, and then the areola is the pigmented skin around it.
Yes.
So what those people are paying for is to have small almond-shaped areolas, not nipples. Now, I have seen that there are some people doing nipple surgeries. It's not super common, but like if people have really large nipples, they might get them reduced. You can actually augment them if you want to, you know, there are certain things you can do that, which that also would be a very weird surgery. But yeah, I mean, what do you guys think? I mean, is that, I consider, I mean, as a woman, like if you're looking at a man and, you know, do you look at their areolas? Is that something that you know, are...
I mean, sure, if that's, if they are abnormally large, I guess that would be something that I'd be like, what's going on?
Okay. Travis, I mean, all right, reverse it. For women, is areola size, is that like important to you as a man? I mean, I don't want to put you on the spot.
No, you are fine. No, it is not.
Yeah.
It's not like something that I like pay a lot of attention to.
I will say that when people have large areolas, it does tend to, especially for women, it gives an impression of older age, right? Because that's a more common thing as women age. For men, like, I don't know. I haven't even ever really thought about men's areolas, except for one exception. One exception is that when I do the gynecomastia surgeries, where
do you reduce the areola size?
I will sometimes if they're large, yeah. Because what happens is when men get, so gynecomastia is the man boobs. We've talked about that in the past. If men get breast tissue enough, it will stretch out the areolas, and they do look. It looks abnormal on men, and so I don't know. Maybe that's what they're talking about in this article. Maybe it's gynecomastia guys that want to have small areolas, which makes total sense.
I highly doubt it. I think they
you think it's like very picky men?
Absolutely. I think
it is New York City.
Yeah, so. In the society that we live in, I'd be willing to bet that they just look at themselves like they have probably the most normal areola, and they're like, I just want a small.
Dude, I want to get in on that action. That surgery is super easy to do. Like I can knock that out of the park. Like because I do so much breast surgery.
Just go to UNT College area. And
men in Dallas,
smaller nipples.
Men in Dallas, if you want your areola smaller, I'll do it, and I'll charge you less than 5 large. I mean, I promise. Like that's New York City dollars. Like I can make this affordable for you.
What would the process be for that?
So it's real simple, man. So you determine how large you want that areola to be. And we use cookie cutters, so it's a perfect circle, or I can freehand a perfect circle if I need to.
Oh, wow.
And then, so you draw that, so that's going to be inside the borders of the areola, and then you go right outside the current border of the areola and make another incision. So it's 2 circular incisions, one inside of another, and then you take out the rim in between, and then you just close it up.
Okay.
And then you have to use certain suture, right, because you don't want it to re-stretch out, so there is, a little bit more to it. But the surgery...
But they don't even want a perfect circle, they want almond. That
could be done. That actually would be... you'd have to be a little bit more thoughtful in how you did the closures, but I mean that could be done too. Like that's not undoable. So yeah, I mean I'm all for. I would do this surgery like in a heartbeat.
We're gonna be walking around Denton, and men are gonna be like, my nipples are
areolas
sensitive.
by Hermann.
Just like all these men walking around.
Areolas by Hermann.
Yeah, I'm gonna get in on that.
No hugs today, please.
Yeah, no hugs. No. I'm a little sensitive today. Okay, so the next one. Have you guys ever heard of Dimpleplasties?
No.
I've heard of people wanting dimples right here.
Yes.
Making dimples for people that don't have them. And wait, hold on. Well, you're gonna have to skip. I had a picture of Beckham that I was gonna show, but we can skip over that. We already finished that. You guys saw his areolas. They're nice. He has nice areolas. All right, moving on. Dimpleplasty. Show that picture, Travis. Yeah, here we go. So this is from Dr. Bldg. Just got this off his website. He's a plastic surgeon in New Orleans, and this is an example of him doing a dimpleplasty. And I have to say that, looks pretty reasonable.
It does. It looks natural. I've seen some. I
It
actually
looks
have heard
cute.
of this. Yeah, I've seen some where they don't look quite as natural.
Hats off to Dr. Bldg because I do think that's very nice work.
Doesn't a rapper have that? Like Nicki Minaj or like one of those girl rappers that has like she has really really.
I know somebody has
dimples.
piercings. I know somebody does have like piercings.
Might be a piercing.
To where like, but I don't know a rapper that has
That
the actual
Dimpleplasty.
surgery. Yeah,
Yeah.
right.
Okay.
Maybe though.
I thought that
So
she did. I forget
this
her name.
surgery's not overly complicated. It would involve making an incision, suturing the underside of the skin, pulling it down to the muscle layer, and then what would happen is over time that suture would scar in. It would make a dimple. I would probably pass on doing these. My concern is the unpredictability of it. You could totally get an instance where one didn't work as well, and it was noticeably different than the other, or if they move their face a lot, the stitch breaks and then it just doesn't work. And it is on the face, so it's very, very visible. And I personally, even though I could do this, I wouldn't do it because now as I've gotten older, like I'm busy enough that I don't need to take on things that potentially could, leave you with an unhappy patient.
And that Sarah, like you said, I do have dimples, but these are not. I did not have a procedure.
Are those Dimpleplasties?
They are not. I promise you. Jesus is my plastic surgeon.
Jesus is your plastic surgeon.
God
That's
gave
a
me
pretty
these.
good one. Yeah, it does good work.
Absolutely.
All right, so the next one, the weird surgery, this one is a little odd, belly button surgeries. I mean, you commonly don't think of people...
For people that have like Audis.
Yeah, that's one of them. So there's a few things that this could relate to, and some of these I've done, others I've not. So right off the bat, Sarah nailed one, which is an Audi. Now, a lot of times when people have an Audi, it can be due to a hernia.
Yeah.
So a hernia is a medical condition. I used to repair tons of umbilical hernias when I was in general surgery. I still repair them occasionally now if I find them. So that's basically where when you're in the womb, you got blood flow coming from the mom, from the placenta to the baby, and it comes in the belly button. That's what the belly button is. It's where your nutrients come from when you're in the womb. And so there's a natural space there where that flows through. Well, it's supposed to shut down after you're born, and most of the time it does, but not always, or it makes a weak spot, and then over the years you get a protrusion of the fat in your intra-abdominal cavity pushing through that, which can make an Audi.
Okay.
So, I mean, that's not every Audi. Some people just have an Audi just due to how that skin formed, when that thing closed up.
Yeah.
But that would be one reason people get belly button surgery. One that I've done is when people have really bad scars from piercings.
Oh, okay.
Belly button piercings.
I know a lot of women that are like, because I work out a lot, and there's a lot of women that are like they have such like small body fat that they have Audis.
Yeah, so they probably have a little hernia. Like the bigger you are, the more hernias hide. And so when I do tons of abdominoplasties, and so I see tons of consults for them, and I'm always checking people for umbilical hernias because the bigger you are, the more likely you won't know that you have it. But yes, if you're very fit, they do show up.
And then especially the women that have had children and are very fit. Like they were very fit
Right.
when they got pregnant and continued to stay
And the
very
reason
fit.
for that is as the uterus expands, the intra-abdominal pressure increases, and it puts pressure on that weak spot where that person had, their umbilical cord when they were a baby. That leaves a weak spot. So it's really common after pregnancy for people to develop an umbilical hernia. They're generally not dangerous unless they're just obscene. So, if you feel like you have a little umbilical hernia that you can't see, I mean, I probably wouldn't mess. In fact, I have one, really tiny. And it's from when I used to lift weights a lot. I used to really lift a lot of weights, believe it or not. This is many years ago. But that huge amount of intra-abdominal pressure did the same thing as what pregnancy did to women. Now, you can't see mine. I can just feel it. I know it's there, but like I'm probably not going to do anything about it because it's not getting bigger and doesn't bother me and you can't see it. So, but yeah, belly button surgery. So as far as what I do these, and the last one is it for the rare instances where people have something catastrophic happen from surgery and they don't have a belly button and they want to create one. I've done that once. That surgery sucks. It's really hard to make a belly button look very natural if you're creating it perfectly from scratch from a sheet of skin. I would probably recommend you do 3D tattooing if you don't have a belly button from, where common people get them is like when they have some sort of trauma surgery or they have some other surgery that goes really badly and then the belly button gets lost. which occasionally happens, not common. I probably recommend people get a 3D tattoo if they.
I would just like not have a belly button. Be like,
It looks so odd though. Like and if you don't have a belly button and you're fine with that, then okay. You have a belly button, don't you?
Yeah, I do.
Oh, okay. I didn't know if you like had some trauma or something. I was like dogging on you if you want to have a belly button. No, to me as a plastic surgeon, if I see somebody that doesn't have a belly button, it does look weird to me.
Yeah, because that's like a sign that you're human. That you
right.
came.
If you don't have a belly button,
That's what I'm saying.
not
Like
alien.
you just
or
don't.
clone. You
Yeah,
can be a
you
clone.
just don't have a belly button and be like, you put 2 and 2 together.
Yep, definitely a clone or a robot. Okay, tongue bifurcation. We talked about this one at some point in some segment, I think maybe a year or
Elf
two
ears,
ago.
yeah.
Don't ruin it. It's coming up.
Oh.
This is the tongue bifurcation. So show the picture, Travis. Yeah, so this is where people want to split their tongue. If you're going to do this, I do think it's a good idea to have a surgeon do it because I've heard that some tattoo parlors doing this, which is a really bad idea.
And that guy has braces and the
bands, yeah.
And the bands.
Like all in there, yeah.
That's a lot going on.
That's a pretty young person there.
Yeah.
Probably 18 or 19.
Oof.
So I personally wouldn't do this. Not that I think it's bad. I guess my biggest concern is person might be unhappy down the road, because it affects your speech and it affects the way you eat.
Is it easy to go back?
It wouldn't be that hard to do it. Like the tongue would probably never look exactly the same because, once you split it and you sew it and it heals, it is going to change it permanently a little bit. Now you could reform it. You could do that. But yeah, I'm kind of out on this one. And not that I think that it's bad. If you want to go have your tongue split, go for it. I would go to a surgeon, not like a tattoo parlor to do it. I just anything where there may be problems down the road, I'm a little iffy about.
Yeah, I've only seen one person that ever has had that.
I
went to like a circus freak show.
It was
with the lizard man.
The lizard man, right? Yeah, you see that a lot.
Yeah.
Like the punk culture, sometimes people do it. All right, and here it is, Travis. You know what it is. It's the elf ear.
I'm excited.
Have you seen this picture?
I've never seen
that picture. I think is fake.
It looks fake.
We did a segment on this right before you came on the show, because Elon Musk's ex, which is Grimes, was asking online about, does anyone know that does elf ear surgery? And I was like, elf ear surgery? So I looked that up. I couldn't find a surgeon that advertised that they actually did it, but I'm gonna tell myself I'm a big Lord of the Rings nerd, and I actually don't like the look. I don't mind the look of that. I think it looks kind of cool. A lot of people look at that and be like, okay, freak show or whatever.
Yeah.
But I'm like, I kind of like that elf ear look.
It's not bad. It's not terrible. Like,
yeah,
I don't know, something about it.
I'd rather have that than that weird tongue thing.
Yeah. And so, could you do that? Yes, you could. I've done trauma surgery on ears. It's easy to clip the cartilage. It's easy to reshape things. So knowing that, it wouldn't be hard to shape the ear cartilage into that point. And I tell you, and I know this because I've been thinking about this ever since we've done this segment, like, could I pull this off? Like, the hardest part would be getting that cusp on the lobe of the ear to look right, because you'd have to like bend the cartilage and you'd run the risk of the cartilage not necessarily surviving, then you'd have to fold the skin over it. So it'd be a pretty technical operation, which you could totally pull it off. I just would be concerned if there would be any complications from it. Because I'm really tempted to like put on my website that I would do elf ear surgery, because I think people would probably show up for it.
Yeah, there you'd have a lot of people with like their little attachments that they wear that you can wear and be like, I want it to look like this.
I think it'd be kind of fun to do. I just, there's not any really data out there on it, and so man, it's so hard to like be that first person to say, yeah.
Some of my friends have them.
Elf ears?
Not like real ones.
Oh,
like the little
attachments. The attachments. Okay, I didn't understand. I thought you were talking about.
I didn't know that. I went with them to that Renaissance fair.
Yeah. Oh,
and
totally.
like all of a sudden, I like get out of the car and they're like, I'm like, oh,
dude, if I could do elf ear surgery, I would just take my business cards to Scarborough Fair, the Ren Fair, and people would be beating down my door. Mm-hmm. There's so many people. I think there's so many
that life.
There's so many people I think would do that surgery. Like when I say so many, I mean probably not enough to keep every plastic surgeon in the country busy, but there'd be enough to keep one plastic surgeon in Dallas busy doing elf ears, I think. But I don't know.
Well, Denton's really weird. So.
Yeah. I mean, I think if I advertised for it, I would get people coming. It's just that there's no real research out there on doing it. So, you'd be basically doing one of the first ones, and if it went great, you'd be, the messiah of elf ears, in the plastic surgery. If it goes bad, then
I think a lot of people play. What's that one game? Is it Dungeons and Dragons?
Oh, dude, I love Dungeons and Dragons.
Right. I think a lot of people play that. Yeah.
They literally have a Dungeons and Dragons type bar in Denton.
Oh, really?
Called D20.
Yeah, D20. Yeah,
Okay.
I've been there. I haven't actually played a game there. I would love to get like a regular D&D game going. I just don't have time. Like,
I've never
when I get
played
older,
that game.
Some of the coworkers here, they play.
Do they?
They have different. I don't know what you would call it, but they play in different groups.
Yeah.
It's not like the same group, but they do play. So I think that will probably be like another like big crowd that will probably like
totally
utilize it.
I'm
what
telling
I mean?
you, man, I may have to get into this. It could be like my specialty, the elf ears. We're gonna keep talking about this till I do it. All right.